Hello, everyone. I am Dr. Chris Danga of Cell Genomics, Abuja. There's this question going around: should third-party embryos undergo genetic testing? I guess that the question has been going around within, between, and among the parties involved in the third-party reproduction. Finally, I have been invited to answer this question in the public today. Generally speaking, I would like to say genetic testing for embryo is a controversial issue. Well, I have figured out three possible answers to the questions. Number one, yes, third-party embryos should undergo genetic testing. And then you ask why. Then I will give you number two. I say, it depends. And then you may ask, it depends on what? Thirdly, third-party embryos should not undergo genetic testing. Again, you may ask why. The following outline of my presentation may just be able to guide us to the appropriate answer. In whose best interest is the answer? The third party, if you like the parties, ethical, legal, or regulatory. Now, we'll not look at the terms, the definition of the terms third-party embryos, and then we'll also look at the genetic testing. Now, we'll look at why third-party embryos and genetic testing. Then we'll look at its implications, and I will conclude from there. The very first assumption in any of the answers is the question: in whose best interest really is the answer? Yes, no, or it depends. The possible parties involved in the third-party embryo genetic testing may include the donor, recipient, the ART service provider, the clinic, regulator, and legislation, all for ethical consideration. But first, I would like us to clearly understand what the third-party embryo is, and then briefly what the genetic testing entails. According to the American Society for Reproductive Medicine, ASHRAM, third-party embryos are embryos that have been donated by a third person, if you like the donor, to enable the infertile individual or couple, that is the intended recipients, to become parents. Now, there are indications for couple in need of third-party embryos. It is important to note that they may include untreatable infertility that involves both partners, untreatable infertility in a single woman or woman without a male partner, recurrent pregnancy loss, though to be related to embryonic factors, genetic testing, or genetic disorder affecting one or both parents, advanced maternal age. And it may interest you to know that up to 36.4% success rate have been recorded for third-party embryo donation in assisted reproductive technology. The need for genetic testing of embryos in ART has risen to facilitate the success to achieving live birth. Most recently are the issues of embryo selections to transfer healthy embryos to favor the patients, to reduce the number of transfers and other factors like potential reduction of miscarriages. Genetic testing of third-party embryos is similar to other PGD protocols, which consist of 4 major steps. Embryo biopsies, in this case, part of the embryo or the portion of the embryo, if you like the cells, one or two are carefully removed without harming the whole embryos. Then a stage of laboratory preparation, the genetic lab preparation. Then you have the genetic testing where you have the gold standard using the instrument of the NGS, next generation sequencer. You look at the evaluation and validation of the digital results with a very high accuracy of up to 99.9% detection rate. Basically, it's a technique in which one cells or more are carefully removed from an embryo for testing to provide information about the genetic makeup of rest of the cells in the embryo. Several literature have highlighted the immense benefit of the third-party embryo genetic testing. This includes the identification of the infertility causes, identification of genetic disease transmissible to the offspring, optimization of the assisted reproductive techniques. Now, the great question, incidentally, the great question of whether third-party embryos should undergo pre-implantation genetic testing has been raised by the work of Maxwell and Griffo in 2018. Should every embryo undergo pre-implantation genetic testing for aneuploidy? A review of the modern approach in vitro fertilization. Interestingly, they concluded, or their conclusion suggested that patients without euploid embryo should be given the options of transferring mosaic embryos after genetic counseling. Coughlin suggested that pre-implantation genetic testing for recurrent implantational failure might be necessary. The study by Rubio et al. In 2017 reported a significant reduction of miscarriage to up to 39.0 in the selection. Rosenwachs in 2018 presented about the pros and cons of pre-implantation genetic testing for aneuploidy. Of course, clinical and laboratory perspective of it. The pros for pre-implantation genetic aneuploidy testing is clinically beneficial and cost-effective. The cons for PGTA risk outweighs the clinical benefit. The work of Neal et al. 2018 further buttressed the pros of the debate, which talk about the cost-effective, shortens treatment time, reduced the risk of failed embryo transfer and clinical miscarriage. Despite the laudable achievement, it is also important to consider the argument that suggested in the pros and cons of genetic testing. Lead et al. In 2020 observed that mosaic embryos can develop into healthy infants with various levels of or types of mosaicism. And it was discovered that there was no significant difference that was observed between the infants from euploid embryos and mosaic blastocyst transfer. I think it is important at this point to share the cell genomic experience with you. Over the past 10 years, our statistics have shown the following. For pre-implantation genetic testing for aneuploidy, the outcome on the third-party embryos resulted to 71% of euploid embryos and 29% of aneuploidy from the third-party embryos. Lastly, I would like to conclude again by asking, should third-party embryos undergo genetic testing? Certainly, the answer will depend on where you are and what circumstances are involved. Third-party generated embryos might provide a lower rate of aneuploidy, but the risk is not completely avoided. And pre-implantation genetics testing still remains a meaningful method of embryo selection. Third-party generated embryos should undergo pre-implantation genetic testing, especially if the accurate history of the donor background cannot be determined. Technically, for the avoidance of doubt, where resources are available, third-party embryos should be encouraged to undergo genetic testing. Ethical and legally, there is no obligation for pre-implantation genetic testing for aneuploidy as yet in Nigeria. However, consideration for ESET will become a cause for fiscal concern. Assisted reproductive technology providers in Nigeria will certainly have major challenges with the group of patients in low income level. But the scenario of penny wise, pound foolish is instructive. At this point, I would like to thank you for listening and thank you for your attention. Thank you.